right. So are you ready to dive into this idea that Big Pharma and the government and insurance companies are all kind of like secretly working together
Oh,
to
yeah.
get people sick?
I think that's a really interesting concept.
Yeah, you sent us some pretty fascinating sources for this deep dive.
Yeah, we've got some really interesting material.
Yeah, so let's just jump right in.
Let's get to it.
Okay, so um, you hear this idea that, these big industries are, kind of colluding together to keep people sick so they can make more money.
Right.
Is there any truth to that?
Well, I mean, it's certainly a compelling theory, right?
Yeah.
And there's a lot of money at stake, so.
Yeah, and there are a lot of people who are, chronically ill and
It's
on
hard.
multiple medications.
Yeah, and I think, one of the things that we have to keep in mind is that there's a long history of powerful industries, kind of misleading the public for profit.
Hmm.
And so, we've got to be careful and really examine the evidence.
Yeah.
So, one of the sources that you sent was this book by Gary Taubes called The Case Against Sugar.
Yeah.
And
I've heard of that book.
yeah, he makes the argument that sugar is actually the primary driver of a lot of these chronic diseases that we're seeing,
Okay.
like obesity and diabetes and heart disease and even potentially cancer and Alzheimer's.
Wow.
And he really goes into the history of how sugar consumption has evolved over time and how it went from being this kind of like luxury item to being a dietary staple.
Yeah, well, I mean, it's in everything.
Yeah, it's everywhere, right?
Yeah.
And, he talks about the economic factors that drove this, this widespread adoption of sugar.
Hmm.
And then he draws these parallels between the tactics of the sugar industry and the tactics of the tobacco industry in terms of downplaying the negative effects of their product.
Oh, that's interesting.
So, that's kind of like setting the stage for us, right?
Yeah.
Because if one industry has done it, is it possible that other industries could be doing it as well?
Right. Yeah, because like big tobacco, was known for, for decades. They knew that cigarettes cause cancer,
Absolutely.
and they hid it from the public.
Right. They suppressed the research,
Yeah.
they paid off scientists,
Sure.
and they ran these big marketing campaigns to mislead people.
Yeah. So is the implication here that like the food industry is doing the same thing with sugar?
Well, that's what Taubes is arguing.
Okay.
And he presents a pretty compelling case.
Oh, okay.
So, we've got to keep that in mind as we're looking at the other sources.
For sure.
Another really interesting source that you sent was some interviews with Brigham Buhler.
Yeah, I'm really fascinated by him.
Yeah, he's got a lot of really interesting things to say.
Yeah, and I feel like what he has to say is probably the most controversial out of like everything that we're going to talk about.
He's definitely not afraid to speak his mind.
Yeah.
And he comes at this from a really unique perspective.
Yeah.
Because he's been a drug rep. He's been a med device rep. He's even owned a pharmacy.
Right. So he's seen it from all sides.
Exactly. Yeah, he's seen the pharmaceutical world from multiple angles.
Yeah.
And so he's got this kind of like insider knowledge that's really valuable.
Yeah, for sure. So like what are some of the most like kind of explosive things that he's claimed?
Well, one of the things that really stood out to me was he talked about seeing innocent people indicted based on information that was like twisted and manipulated by insurance companies.
Wow, that's pretty heavy.
Yeah, it's pretty disturbing.
Yeah.
He also talked about this lack of oversight for big pharma manufacturing facilities, like compared to compounding pharmacies, which are like these smaller pharmacies that make custom medications for patients.
Okay.
And he was saying that like compounding pharmacies are subject to all these like really strict regulations,
Yeah.
but big pharma kind of gets away with a lot more.
That's interesting.
Yeah, so it's almost like a double standard, right?
Yeah, it's like there's different rules for the big guys and the little guys.
Exactly. And that raises some concerns.
For sure. For sure.
He also talked about this idea of like banning substances like peptides,
Okay.
which are these like short chains of amino acids that can have all sorts of like therapeutic benefits.
Okay.
And he's saying that like when the government bans these substances, it doesn't actually stop people from getting them.
Right.
It just pushes them to the black market.
Yeah, so it makes it more dangerous.
Exactly. And he draws a parallel to the opioid epidemic. He's saying that, when they started cracking down on prescription opioids,
Yeah.
people just turned to heroin and fentanyl.
Right, right. Yeah, and those are way more dangerous.
Right. So it's like this unintended consequence of prohibition.
Yeah, for sure.
And then he gets into this whole idea of like managed care plans versus true health insurance.
Okay. I'm kind of curious about that.
Yeah. So he's saying that like true health insurance is supposed to be about like protecting you from financial ruin if you get sick,
Yeah.
But managed care plans are more about like controlling costs and maximizing profits for the insurance company. And he's saying that these managed care plans are actually incentivized to keep people sick
Really?
because they make more money that way.
Wow.
Yeah, he even uses this phrase like monetized disease states.
Wow. That's a pretty chilling phrase.
Yeah, it's pretty dark.
Yeah. So, but how do they do that? Like, how do they actually like keep people sick?
Well, he points to these things called pharmacy benefit managers, or PBMs.
Okay, I've heard of those, but I don't really know what they are.
Yeah, they're kind of like the middlemen between drug companies and insurance plans.
Okay.
And they basically decide which drugs are covered by the insurance plan, and they negotiate the prices with the drug companies.
Okay.
But Buhler is saying that there's a lot of like shady stuff going on behind the scenes.
Like what?
He's saying that PBMs often get kickbacks from drug companies to put certain drugs on their formularies. So it's not always about what's best for the patient.
Oh, wow.
It's about what's going to make the PBM the most money.
So they're putting profits ahead of people's health.
That's what Buhler is suggesting.
Yeah. Wow, that's messed up.
Yeah, and he also claims that they've blocked access to preventative care because it's cheaper in the short term to keep people on meds than to prevent the illness in the first place.
Wow. That's
So
like...
it's like they're betting on people staying sick.
Yeah, and then they're making money off of that.
Right, and he brings up this really disturbing statistic.
Well,
He says that suicide rates have actually increased despite more people being on antidepressants.
wow.
So it makes you question, like, are these meds actually effective?
Yeah, it really raises some red flags.
Yeah, it's definitely something to think about.
Yeah, so we've got Big Pharma kind of like, maybe cutting corners, and then we've got the government making these like questionable choices about what to ban, and then we've got insurance companies like profiting off of people's illnesses.
Right, and it's all interconnected. It's like this complex system where all these different players are kind of like working together.
Yeah.
Even if they're not consciously doing it.
Right.
It's just the way the system is structured.
It's almost like Eisenhower was onto something when he warned about the military-industrial complex.
Right.
Like, could something similar be happening in healthcare?
That's a really good question, and it's definitely something to keep in mind.
Yeah.
As we're exploring the other sources that you shared.
Okay, so before we move on to those, I'm curious, like, what are your initial reactions to all this? I mean, honestly, it's a lot to take in.
Yeah.
I mean, on one hand, it kind of sounds like a conspiracy theory,
Sure.
Like Big Pharma and the government working together to keep us all sick.
Right.
It's like, is that really happening?
Well, I think it's important to remember that we're not talking about some like shadowy cabal meeting in a dark room,
Yeah.
It's more about like a system with built-in incentives that kind of like lead to these outcomes.
So it's not necessarily malicious intent,
Right.
but it's just like a system that rewards keeping people on medications rather than finding cures.
Exactly. And when you have powerful players like Big Pharma and insurance companies lobbying for policies that benefit their bottom line,
Yeah.
it's easy to see how the system can get skewed.
Yeah, so it's like the system is rigged in a way.
In a way, yeah.
Okay, well, I mean, if we're kind of like stuck in this system, then what can we do about it?
Well, I mean, becoming a survivalist isn't really a practical solution for most people.
Right. Yeah.
But there are some interesting alternative approaches to health and wellness out there. You actually included a few sources on the carnivore diet.
Oh, yeah, those were pretty interesting.
Yeah.
Dr. Ford Brewer and Ken D. Berry.
Right. They're both big proponents of that diet.
Yeah, they claim that it can reverse a whole bunch of chronic diseases like diabetes and heart disease.
It's a pretty radical departure from the mainstream dietary advice we've all been hearing for years.
Right. I mean, especially when you consider what Taubes was saying about how the sugar industry kind of like manipulated the narrative around fat and sugar.
Right.
It makes you wonder, like, what other kind of like conventional wisdom is actually wrong?
Exactly. And Brewer and Berry are basically saying that the low-fat craze was based on shaky science.
Yeah.
And might have actually done more harm than good.
Okay.
They're arguing that processed carbohydrates are the real culprits.
Yeah.
They're messing with our blood sugar and our insulin levels, and that's potentially leading to all sorts of health problems.
Okay, so their solution is to just cut out carbs completely.
Essentially, yes.
And just eat meat.
Right. They advocate for this like nose to tail approach.
Okay.
Where you're emphasizing the nutritional value of organ meats and minimizing plant-based foods.
I gotta be honest, that sounds a little extreme to me.
Yeah, it's definitely not for everyone.
Fair.
And it's essential to do your research and consult with a healthcare professional before making any drastic dietary changes.
Right, of course, of course.
But you know what I find interesting is that even if the carnivore diet isn't the answer for everyone,
Yeah,
it does challenge the conventional wisdom about nutrition.
for sure.
And that's a valuable thing.
Yeah.
It encourages us to question the status quo
Right.
and think critically about the information we're being given.
Yeah, especially when it comes from industries that have a history of putting profits ahead of people's well-being.
Exactly.
Yeah.
And speaking of challenging conventional wisdom, you also sent this talk by Nina Teicholz
Yeah.
called Big Fat Nutrition Policy.
Yeah, I watched that one.
Yeah, and she really goes after those low-fat recommendations, too.
Yeah, she does.
She's arguing that those recommendations were based on flimsy evidence and were driven by personal agendas and politics rather than solid science.
Wow.
And she even claims that a small group of influential individuals basically controlled the nutrition narrative for decades
Oh, wow.
and suppressed any research that contradicted their low-fat dogma.
That's a pretty shocking claim.
It is, but she backs it up with some compelling evidence.
Wow.
And it ties in with what we were discussing earlier about how powerful entities can shape the information we receive, even when it comes to something as fundamental as what we eat.
Right. Yeah, I mean, it's like that saying, like, who controls the food supply controls the people.
Exactly.
Yeah, so if we can't even trust the dietary guidelines,
Right.
how can we be sure we're getting accurate information about medications and treatments?
That's a scary thought.
Yeah, it's a little unsettling.
It is. It makes you wonder how much of what we've been told about health is actually true.
Right, yeah.
And that's precisely why it's so important to be critical thinkers, to
Yeah.
question everything,
Yeah,
and to do our own research.
for sure.
You know, we can't just blindly accept what we're told,
Right.
especially when it comes from people who have a vested interest in keeping us sick.
Yeah, I mean, it's like we're living in a health information war zone.
In a way, yeah.
Yeah.
There's a lot of conflicting information out there.
Yeah.
And it can be overwhelming to try to sift through it all.
For sure.
But, you know, that's also where the power of individual choice comes in. You know, we have to take responsibility for our own health,
Yeah.
even if the system is working against us.
So you're saying we can't just blindly follow the advice of experts
Right.
or rely on institutions to take care of us.
Exactly. We have to become informed consumers of healthcare.
So what does that look like in practice? Like, what can we actually do to protect ourselves?
Well, there are actually quite a few things you can do, and we'll delve into those in more detail in the next segment.
Okay. All right. I'm ready for some actionable advice. Let's get to it.
Let's do it.
Okay. So we've got, Taubes exposing the sugar industry and Buhler kind of blowing the whistle on big pharma and insurance companies.
Right.
And Teicholz, challenging the low-fat dogma. Like it's starting to feel like we're living in like a health information war zone.
In a way, yeah.
Yeah.
I mean, there's so much conflicting information out there.
Yeah.
It can be really overwhelming to try to sift through it all.
It is.
But I think, that's where the power of individual choice really comes in. We can't just sort of blindly follow the advice of experts.
Yeah.
We have to become informed consumers of healthcare.
So what does that actually look like in practice?
Well, I think, one of the most important things is to remember what we learned from Brigham Buhler: knowledge is power.
Right.
The more you understand about how this system works, the better equipped you'll be to advocate for yourself.
So like step one, don't just blindly trust doctors or insurance companies. Like do your own research.
Exactly. Ask questions.
Right.
Don't be afraid to challenge the status quo.
Right.
You're paying for these services.
Yeah.
You have a right to be informed and involved in your own care.
Okay, got it.
And, think back to what Buhler said about the future of healthcare: preventative, predictive, and personalized.
Right.
Even if the system isn't there yet, we can start incorporating those principles into our own lives.
So like focusing on staying healthy instead of just reacting when we get sick.
Exactly. Take advantage of preventative care options, get regular checkups,
Yeah.
Consider genetic testing if it's appropriate for you. And most importantly, listen to your body.
Yeah.
Don't ignore those early warning signs.
Yeah. That makes sense. Catch things early, potentially avoid bigger problems down the road.
Exactly. And the personalized part is key too. What works for one person might not work for another.
Right.
So don't be afraid to experiment.
Yeah.
Find what makes you feel your best.
That's kind of where those alternative approaches to health come in, like the carnivore diet.
Right.
They might not be mainstream,
Right.
but they offer like different perspectives.
Yeah.
And they could be a good fit for some people.
Absolutely. The key is to keep an open mind, Do your research and find what works for you.
Right.
Don't just blindly follow the crowd or accept what you're told without questioning it.
So much of what we've talked about today is like questioning the conventional wisdom.
It is.
Yeah.
We've got Taubes questioning the conventional wisdom about sugar. We've got Buhler questioning the conventional wisdom about pharmaceuticals and insurance.
Yeah.
And we've got Teicholz questioning the conventional wisdom about dietary fat.
Yeah, and she's saying that, a lot of that conventional wisdom was based on like bad science and personal agendas.
Exactly.
Yeah, it's a little unnerving to think about.
It is.
Like how much of what we believe about health is actually true.
It's a valid question.
Yeah.
And I think that's why it's so important to be critical thinkers, to question everything.
Yeah.
And to do our own research.
Okay, so that's kind of like the individual level.
Right.
Like what can we do as a society to like address these issues?
Well, I think, one of the most important things is to raise awareness.
Okay.
We need to start talking about these issues more openly and honestly.
Yeah.
We need to educate ourselves and each other about how the system works and how it's impacting our health.
Yeah, for sure.
And we need to start demanding better from our healthcare providers and from our policymakers.
So like hold them accountable.
Exactly.
Okay.
We have the power to change this system.
Yeah.
But we have to be willing to speak up and demand change.
Okay, so be informed, be proactive, and be vocal.
Exactly.
All right, I like it.
And I think it's also important to remember that we're not alone in this.
Right.
There are a lot of other people out there who are concerned about these issues.
Yeah.
And who are working to create a better system.
So like connect with others.
Yeah. Find your tribe, share information, support each other.
Yeah, strengthen numbers.
Exactly.
Okay.
And, don't forget that final point from Buhler, be optimistic.
Right.
There's a lot we can do to improve our health, even within the limitations of the current system.
It's like that old saying, knowledge is power, but it's useless without action.
Well said.
Yeah. So be informed, be proactive, be connected, and be optimistic.
I love it.
Those are our takeaways for today.
Absolutely.
This has been a really eye-opening deep dive.
Yeah?
And
Yeah.
I'm honestly feeling a little bit overwhelmed by all this information.
Yeah. It's a lot to take in for sure.
But I'm also feeling empowered.
Right.
Like I can actually do something to protect my health.
That's the goal.
Yeah. So thank you for sharing your insights with us
My pleasure.
and for helping us to navigate this complex and often confusing world of healthcare.
Anytime.
All right, that's it for this deep dive. We'll see you next time.